This is one episode of a three-part series based around education and information for school-based telehealth. To see the other episodes, follow the information in this video's description. This series of videos was designed to provide educational content for federally qualified health centers and rural health clinics to assist with their telehealth implementation. The content is also useful for other types of providers and organizations. The following video will cover these specific topics.
Hi, good afternoon, everyone. I'm Allison Jackson, and I'm the family nurse practitioner, and I'm also the School-Based Health Center Director for Beaufort, Jasper, Hampton Comprehensive Health Services. Our mission statement is to provide quality, affordable, accessible, and comprehensive healthcare services to the South Carolina Lowcountry. We are a federally qualified health center, and we have been providing comprehensive health services to residents for 50 years now. The benefits to having a school-based health clinic is that there's no additional charge to the district. The district doesn't have to pay for anything to have us in the school. The district can still bill for their school nursing services to their Medicaid students. And then our staff also assists the school nurses with their South Carolina Department health screenings that they have to do every year, which are hearing, vision, obesity, blood pressure, and dental screenings. And then when the school nurse refers a child to us, he or she can be reassured that the child has been treated for the disease or condition, because so many times they refer them back to their doctor and they're not sure if they were seen for that fever or for that cough. So having a school-based health center is very important to the school nurse, and she knows that child was cared for. Essentials for the school-based health clinic to have with the school district is to make sure you build that collaborative relationship with the school nurse. She is your buy-in. If you don't buy her in, it's going to be tough. Without the school nurse, you can't do a whole lot with your program because she is right there on the boots on the ground. She knows the students and she knows the school and the community. And then also having that with the school's administrators, such as your principals, assistant principals, and even up to your district services personnel and the superintendent. And then not only at the school level, you need to continue to build those collaborative relationships with the community, such as the parents, the grandparents, the key stakeholders in the community, and churches. And sometimes the churches are the key stakeholder for that school. And then also I work hard to make sure that I'm accessible to the community partners, to the parents, to the children, to the school administrators, and the school nurse. And that's kind of how we got started with our school-based health center, our first school-based health center 25 years ago. When you're starting your school-based health center, you have to have a memorandum of agreement with the school district to kind of lay out what you're going to do and what the district is going to do and what's your place and what's their place. The memorandum of agreement is several pages long, but I just highlighted some key points that you will want to have in your memorandum of agreement, which you want to make sure it outlines that you have the proper access to the students. If your school-based health clinic is embedded inside the school building, you need to have a secure internet service to operate your electronic health record on. And you need to have the ability, if you have a telemedicine program like we do, you want to have the ability to store your telemedicine card in a secure location because it's a very expensive equipment. And then also, you want to make sure that you in the school protect the students' privacy and that they're seen safely and confidential. And then there needs to be a designated area for you to provide that service, whether it's for in-person or telehealth. So like I said, we started 25 years ago, back in 1994, we were asked to come into the school to help reduce the teen pregnancy rate in Jasper County. But we are located down at the tip of South Carolina. We're in Beaufort, Jasper, and Hampton counties. And so we were asked by the school district to come into the school to help reduce the teen pregnancy rate over 25 years ago. And since then, we have expanded from one Jasper County high school now to the entire Jasper County School District. And also we expanded to Beaufort County School District with 5 schools in that school district. Then we even expanded back in 2012, we expanded to Hampton County schools, Hampton County District 1 and 2, and then recently we added Polaris Tech Charter School. And those school services through our school-based health center mobile, where we have medical and dental on that mobile care unit. And in the school-based health clinics, those in Beaufort and Jasper County, we provide in-person care as well as telehealth. So in our last year of schools enrollment, roughly about 6,400 students, 2,000 of them were enrolled into our school-based health center, which gives us at the rate of 30%, which is pretty good. And that's for Beaufort, Jasper, and Hampton County schools collectively. And we strive to increase this rate each and every year. We would like for it to be 100, but first it was 10% was our goal, and now we have increased it to 30%. So how the parents sign the children up for services, we do a blanket enrollment of our registration packets at the beginning of the school year. This year, of course, is a whole lot different because the students didn't go back to school. So we had to come up with a way to register them virtually by creating a virtual or online registration. And then, of course, students are signed up as needed as the nurse sees fit that they need to be seen and the parents agree. And then at some locations where we do have that family nurse practitioner, then the teachers and the staff can also be seen at those on-site locations and telehealth. So for our operations and staffing, we have 4 school-based health assistants. We have myself, who is the nurse practitioner and director, which is pretty much full-time. And then we have a part-time family nurse practitioner, and 1 part-time pediatrician that goes to the schools. And we also offer telehealth services as well. Due to COVID, we really had to switch gears, and I actually became one of the COVID screeners for our whole entire agency. And a lot of us did when schools closed. So that's how we kind of compromised during that time. We have 2 registered dietitians, 2 behavioral health providers, and we have about 3 dentists and 2 dental hygienists and some dental assistants to provide our dental services. So we offer comprehensive services in person and via telehealth throughout the agency. We have medical services where we do those well child checkups. We also do disease prevention and health promotion. We do treat the child for acute conditions like rashes, eczema, allergies. Then we have our registered dietitian provides wellness and nutrition counseling. Our dental provides dental visits through telehealth. And then our behavioral health providers offer their behavioral health counseling. They see children for a variety of problems such as anxiety, depression, ADHD, oppositional defiant disorder, and autism, just to name a few. So the cost for our services is completely covered by Medicaid, so it's free to the parents or the child. We do accept private insurances as well. And because we are that federally qualified health center and we have grant money available for our uninsured patients, we do have a $30 fee for our medical services, which is our medical or plain medical services, our nutrition and behavioral health is all wrapped up in that $30 fee. And that fee is paid once a year by the parent. Each year they enroll, they will have to pay another fee. And then our $50 fee is for our dental services as well. And that includes the dentist, the dental hygienist, and exams, cleanings, and minor restorative care. So when we went telehealth, the medical services were already being paid for and covered by our South Carolina Medicaid system and the managed care organizations. They currently pay us at our encounter rate. But due to COVID, at the time before COVID happened, our behavioral health telehealth services was not being reimbursed prior to COVID. So we were really providing that service and we was not getting reimbursed for it from Medicaid. So when COVID happened, we were very excited because then the Medicaid system allowed for our licensed independent social worker and our licensed master social worker to get reimbursed for the services that they rendered via telehealth. And currently, our nutrition, we recently found out, however, Medicaid is not paying or reimbursing us for our telehealth nutrition services due to lack of medical necessity, they say. So that is one area that we would like to work on. And then our telehealth, teledental services that are offered is reimbursed, but they only reimburse for acute care only. The child still has to come in person for their preventative care, like their cleanings and their comprehensive preventative exam. Also, another thing for our medical services are well child checks. The Medicaid said that they would pay for a well child check, and it can be done in 2 parts. So we do the first part via telehealth, and this is done from like the child's home with the parent, and then we bring them into either our school-based health center or our medical center to complete the well child check. So our percentage of payers, the schools that we serve are Title I schools, which means that the child's a free and reduced lunch rate is for the school is like 90% and higher. So just about every child has Medicaid in the school, and then some are uninsured, and those are usually our children who come from a different country and who are not eligible for Medicaid. And so only roughly about 10% of the children that we see is uninsured, and then 6% has private insurance. But majority of our children that we see is Medicaid, and Medicaid does pay for our services. So that's how we become sustainable. And through our grant that we have, which we get roughly about $300,000, and then from our grant, and then we usually make that back by seeing the children in the school. So why did we choose telehealth? We chose to add telehealth to our in-person care to increase access for the provider and the student, to kind of limit the transportation between sites. If a child was sick at a school, I didn't have to get in my car and drive to another site. And now we're in a pandemic, so now we can see the child from home, which is very important. So the way we started off our telehealth, our telemedicine program, you will hear those words used interchangeably. We partnered with MUSC and the South Carolina Telehealth Alliance, who was funded by a grant that they provide the equipment at no cost and the training at no cost to our staff. So we started back in August of 2016, I believe, and we started in phases. So we just started our telemedicine with the school nurses inside the school in Beaufort County, and then eventually a couple of years later, we added Jasper County into that mix. And those are with the telemedicine carts. They use a Vizia telemedicine carts. And then we use the school nurse as the telehealth presenter. We also use laptops for our telebehavioral health program. And all of this has to be secure and HIPAA compliant for conferencing through the following servers that are below. They use Cisco Jabber on the carts, Vigio on the laptops, and then through our electronic health system, we have eClinicalWorks, and we do our Helo televisits. And some options below is the Doxy.me, Doximity, and Zoom. So I already touched on how we had to change during COVID. So we do a lot of telehealth visits now, way more than we ever done before. And the schools are still in a hybrid model, so we're still rendering those services via telehealth. We are starting to add in some in-person care, which completion of those well child checks. And we plan on using the telehealth platform as we begin to open up more in person to add the parent into the visit. So we can use like that Doximity to add the parent into the visit since they can't physically be there. Some challenges with telehealth is the child is not readily accessible due to the parent's availability. So if it's a small child, the parent's at work, you can't do it. Also, it's hard to reach the parent to schedule the appointment. Whereas when they were at school, they were at school, you go ahead and schedule them and they were seen. We serve a large rural area, so some of them have very bad internet connection and Wi-Fi access, so it can make a visit more difficult. And we always strive to maintain our sustainability with our billing. If anything changes in the school, like your school nurses or your school administrators, you kind of have to re-promote your program all over again. So that kind of slows things down. Some benefits to end with our program is to reduce the emergency room visit, reduce the number of absences for the students, reduce missed time work for parents, and the transportation barriers for the parents. With the parent there, we're able to gather more information, have them more involved with the child's care, and assess the child's living environment, as Andrea already kind of touched on. And like I said, we plan to incorporate this more as we move forward to in-person care as COVID starts to go away. And that is the end of my presentation. I thank everyone for having me. And if you have any questions, please feel free to put them in the chat. And here is my contact information.
This series of videos is presented to you by the National Consortium of Telehealth Resource Centers, the NCTRC. The NCTRC is funded through the U.S. Department of Health and Human Services, the Health Resources and Services Administration, and the Office for the Advancement of Telehealth. This map represents the NCTRC, which covers the whole United States and includes 12 regional TRCs and 2 national TRCs, which are the National Policy TRC and the Telehealth Technology Assessment Center. The TRCs have been in existence since the early 90s and were established to provide assistance, education, and information to organizations and individuals seeking information on providing healthcare at a distance. The NCTRC mission is to expand availability of healthcare to underserved populations through telehealth. For more information about telehealth, the NCTRC, one of the 2 national TRCs, or your regional telehealth resource center, please contact us through the NCTRC website. Thank you for joining us in reviewing this video series.